Ebola. The pathogen that causes Ebola is a virus. It is also known as the Ebola virus disease, and it is a deadly disease that has occasional outbreaks. These outbreaks are predominantly in Africa, and the first reported case was in 1976. Signs and symptoms. The common symptoms of Ebola virus include high fever, headaches, muscle pain, sore throat, bleeding, and vomiting. More severe symptoms are internal bleeding, vomiting, coughing up blood, having a rash, bleeding from the ears, eyes, and nose, and having bloody diarrhea. How it is transmitted. The Ebola outbreak originated from an unknown animal. The way that it spreads from an animal is when a human touches the infected blood or other body fluids of the animal. The Ebola virus is transmitted through close or direct contact with someone who has been infected by or has died from the virus. It can also be spread by contact with body fluids such as blood, vomit, sweat, and saliva of a person infected by the virus. It cannot be transmitted through air, water, food, and insects such as mosquitoes. Treatment. As symptoms of the virus result in lots of blood loss, an effective way to treat patients is by blood transfusion. This replaces the blood lost as well as potentially outweighing the infected blood cells and therefore weakening the virus. There are not any known side effects to any of the medication provided for treating the Ebola virus, and there is also no vaccine, although scientists have come close to completing one in recent years, and there are several in development by both doctors and scientists. Other treatment includes oxygen therapy, which provides external oxygen for people who experience breathing problems due to the virus. Management strategies. The ways that EVD was prevented from spreading are: if someone is showing symptoms of EVD, they are encouraged to seek medical care and get tested for the virus immediately. This prevents someone from infecting others whilst they are unaware that they have the Ebola virus. The risk of spreading the virus can be reduced through the procedure of disinfection and environmental decontamination. Travel restrictions are not put in place, but it is highly recommended to avoid traveling to areas affected by EVD outbreaks. If people do choose to visit these areas, it is important that they maintain healthy hygiene practices. People are also advised to avoid exposure to body fluids of infected people and animals, either dead or alive. It is important to identify the people who may have contracted the virus from someone else who has tested positive to Ebola. Data. In total, there were more than 28,600 cases, 15,000 of those confirmed, as many were suspected and probable. More than 11,300 people died between the years 2014 and 2015, which was when the Ebola virus was mostly spread. Sierra Leone was the most affected area, with almost half the amount of total cases and nearly 4,000 deaths. The most cases in a non-African country was the USA, with 4 cases, and only one person died from a country outside of Africa, and they were from the USA.